I am Deshpande, 70 years old.
I am Mrs. Deshpande. I have done my masters in music.
After my retirement, I was leading a very happy life with my wife. No responsibilities and no commitments. I was in a habit of early morning walking because I had a little diabetes also. All of a sudden I was not enjoying my morning walk.
He has got some restlessness after walking and all that.
Pain in my shoulders while I walk, especially when it is an uphill task.
So we went to Dr. Lakshmi Gowda.
Immediately he said, you don't waste your time. I will give a letter and you go to Jaya Institute of Cardiology.
We had with us a 70-year-old gentleman who had difficulty walking and difficulty breathing, especially on exertion. And he was diagnosed with degenerative severe aortic valve stenosis.
There are 2 blocks in your coronary artery, and then one valve has already gone. It is not functioning. Other thing they told me, no, there is nothing to worry. You have an option. There is a open heart surgery. It may take more than 5 to 6 or 10 hours depending on that, and you may lead blood. And it may take 15 to 20 days for recovery. Whereas other option is this TAVR procedure, we call it as.
We offered him TAVR, which is a non-invasive way of implanting aortic valve through a femoral route like we do angioplasties and angiograms. There is no cutting open of the chest that happens. The procedure per se lasts for about 45 minutes to 1 hour, and it is done predominantly under local anesthesia. Patient will be awake during procedure. Very rarely in sub-select cases we may have to give general anesthesia to patients. This procedure was done uneventfully, successfully to the patient, and he was discharged on day 3. Patient is on regular follow-up, is stable and comfortable.
Next day they took me to the ward. It was quite simple, and evening they said you can walk. I started walking in the evening. Next day morning you can go home. I went back to my normal, instead of 2 kilometers of walking, I started making it 6 kilometers. I did my, the writing and reading and more.
And the procedure is very simple and it is easy for the patient also.
I'm very thankful for this Meril Pharmacy for doing all this. Thank you.
We at Jaya Hospital, Mysore have been doing these procedures very regularly. Our staff are very well trained. We have all the facilities available to do this procedure. So majority of patients who have undergone this procedure are doing well in their lives. So I urge the patients to accept this technology.